Hi everybody, it's Kristen, also known as Kissy Baby 1984. I am doing my first official Trying to Conceive video log live. I hope you guys enjoy it. This is my first video, so if it's not as great as all of yours, please bear with me. I am going to talk about an IUD I had taken out on December 9th. I would also like to talk to you guys about a Trying to Conceive kit I put together, my charting and OPK tests that I've been charting for a little while now. Now, I've been trying to conceive for 5 months with no luck, obviously no baby in here. But trying to conceive for 5 months, no luck. I had an IUD about 2 years ago and had it taken out December 9th. Some pros to that IUD I found is it does prevent pregnancy. So yes, by all means, if you are looking to prevent pregnancy, I would look up what IUD means, talk to your OBGYN. They can give you some really good advice, some pros and cons to having an IUD. But my pros, yes, it did prevent pregnancy for the 2 years that I've been with my fiance for 6 years, but for 2 years I had an IUD. Before that I did the preventative pill, which was good, but I found that I got very irritated or agitated very quickly. So we stopped the hormone and took the IUD. Provera is the one I had. It's just a little plastic tee that is put in your female parts to stop you from getting pregnant. Cons to it: my cycles were never on time. I did find that with the IUD, my periods could go from a normal 7-day period all the way up to a full month at times. So really inconvenient for myself. I'm sure a lot of you guys have really good experience on it, and props to you on that, but I won't be getting another IUD just because it just did not work for me. We'll try to look into other contraceptives when that time comes, because as of this moment we're trying to conceive, so we're doing everything we can do that's possibly available to us at this moment. I do have a doctor's appointment though set up for July 8th, so I hope you all follow me. If you do follow me, you'll get an update on that doctor's appointment. I'm kind of excited but nervous because I really don't want them to tell me what I probably already know. Let's hope that that's not the problem. But talking to you about the IUD, so again, pros, it does prevent pregnancy. Cons: my cycles were never on time, and they would last between 7 all the way up to 30 days. So that's the IUD. Then I would like to talk to you guys a little bit about my Trying to Conceive kit. Now, my Trying to Conceive kit started off with this. It is a fertility test for women. It's a first response. I had a 2-pack. I did take one of them on cycle day number 3, and it came out positive. It said, I guess if you see like 2 lines or something. I haven't opened it, and I took it almost 3 months ago, so I don't really necessarily remember what it said. I do know it said positive though, so it's a continue to try to conceive, which again we continued to try, but nothing, like I said, no luck yet. But I'm not going to get my hopes up. The second piece to my Trying to Conceive kit was a basal thermometer. It looks like this, if you guys haven't seen it. It looks like a normal thermometer, but I guess it's supposed to read like 1/10 of a degree higher, and that's usually the time that you're ovulating, which I'm actually going to have a question for you guys later on, because my charting, yeah, we'll show you. The third piece was these. They really work wonders. Thermometer tip covers. I recommend you guys all to get them. Nobody wants to put a thermometer back in their mouth after it's been sitting all day long, even though if you clean it or whatever, sometimes you just don't want those extra germs. So thermometer covers really work very well. I definitely recommend you guys getting those. Third piece of equipment, which actually was always in my kit but I never really knew it, vitamins. Everybody, vitamins are good for you no matter what. I take the little Flintstones. They've got iron in it, which I have very low iron. I also have it's got the folic acid. I don't know right now what MCG means, which I probably should, but I don't really care to find out either. But I also bought, just in case I'm not getting enough folic acid, I did get these prenatal tablets with folic acid. That folic acid on here is 800 mcgs. So between the both of the pills, and I take them every day, like clockwork, and I've been taking them. So this is probably like my 4th or 5th bottle. I also have very low iron. I've suffered it from low iron since I was a child. I've always had to take iron supplements. I have not been taking them faithfully since I've been diagnosed with anemia, but they're like this. Anybody, you can get them from any store, over the counter. They give me very bad headaches, so I don't like taking them. I seem to do pretty well without them. I eat a lot of foods with iron in it, and that just seems to do me good. And the last piece that I got for mine was I went on to Amazon.com and found these really cool ovulation. It's a 40-pack of ovulation tests. They come just like that, as you can see. Yeah, a whole bunch of them. And they came with 10 free pregnancy tests, which are in a little blue thing. So go onto Amazon. They're $11.63. I'm not sure if you guys have different money, or if you are, when you go on Amazon, if it's calculated out differently for you guys. But in America, they're around like $11.63. They may go up, they may go down, so don't quote me on that actual price. But that's what I paid for mine. And I got 40 ovulation tests and 10 pregnancy tests. So that completes my actual trying to conceive kit right now. Now, I have purchased other ovulation tests that were more expensive, like the clear blue tests. But again, they're very expensive and not really worth it if you can't keep track of what your cycles are. The second thing is that you don't want to buy a lot of those type of tests, the very expensive ones, if you're not tracking correctly, if you have not even cycles. Get your charting down, kind of get a flow together. Then I would recommend, if you want, pulling another one of those, because you're going to spend a lot of money on those particular tests. They are great tests, but very, very expensive. So my experience is, do the cheap tests for now. If it detects that you have the LH surge, that's really all you need, is just a test to detect that, which I'm going to show you later on with my OPK tests. I'm going to show you what I've done so far. But for now, I want to show you my, and I'm cutting it here. It's because 8 minutes already. So fertilityfriend.com I'm using for my charting. I'm going to show you this real quickly. Take a look. As you can see, I've been charting since April 26th all the way up till May 14th. So far, it's never been the same. I've had a different temperature every day. It goes up, it goes down. So questions to a couple of you guys that are doing this. If you have any advice on this at all, is it supposed to look like this? Is it not supposed to look like this? Please, any advice that you have would help. Again, I don't know really what I'm doing here. This is, again, the first month I've actually charted. Now I'd like to talk to you guys a little bit about, and bear with me because this is a new webcam, so sometimes it works, sometimes it doesn't. So anyway, I'm going to show you guys this real quickly. As you can see, it starts off May 7th, cycle day 12, goes all the way to May 14th, cycle day 19. And if I bring it over here, you guys can see the tests. They're all negative. I don't know if I'm doing it right. Excuse me. I don't know if I'm doing it right. But the tests are anywhere between 5:45 a.m. and all the way up to 9:20. Most of them are around 7 or 6:45 when I test. But again, they're all negative. On May 11th, the 16th, I did have one slight line. I'm not going to show you the test. I don't have time. But if you have any advice on these OPK tests and what I should be doing, please advise. Bye, everybody.